We're in downtown Toronto. We're with Dr. David Carr, who's Associate Professor of Emergency Medicine. And of course, we're talking about COVID. Dr. Carr, welcome to the show and thank you for coming in.
Oh, thanks for having me.
Downtown Toronto, it's like a ghost town, has been for weeks, if not months. And people are scurrying around the city as though there's the plague out there. Is this good for people? Is it necessary?
I think it was necessary. I think we've done a lot of goodness by avoiding a lot of future illness. But I think now is a time, and it feels about right, to think about the next steps.
Which is?
Well, commerce has to go on. We need to, at some point, open up the economy and keep a close eye on it as we're doing it.
What about schools and sports? It seems to me that young people are those maybe hardest hit by the whole public health lockdown.
Yes, certainly there's lots of victims of COVID and the second victim syndrome, the people who, the externalities that we didn't predict. I got 3 teenage kids. They're not going to camp, they're not going to school in the way they did, they're not doing their extracurricular stuff, and this is extremely emotionally tough on them.
Is it necessary right now, or could we have people going to schools in the morning and then another class in the afternoon?
Well, I think we're going to have to be creative, and these are new times. I know in Europe, where my nieces and nephews are at school, we're putting the younger kids in school in the morning, knowing that they can't stay home from school because it's too much of a drain for their parents to provide childcare. It's important to get the young kids to school, and I think come the fall, we're going to have to be creative of how we reintegrate children back into the classroom.
So come the fall, the authorities are working on that now, I'm sure, but what about the summer? We're being told there's no summer camps, there's no sports. We have a whole generation of kids, as you say, who are at home. Is that healthy?
It's probably not healthy, but I don't think we've had enough time to really prepare of what the alternative is. I think the overnight summer camps of putting kids in a cabin and the legalities and impacts of that are huge. I think outdoor programs and things that hopefully ramp up in the late summer, maybe we can improvise and audibilize come August. But I don't think in June we know exactly where we're going.
So we don't know exactly where we're going. No one does. You're an expert. Are we being too cautious? Should we be experimenting? Should we be saying, okay, let's try day camps?
Yeah, time will tell. You know, it's hard to commit. You know, you look at Sweden, who took an approach, and their epidemiologist who drove the pandemic response has come out apologizing for getting it wrong. There are going to be errors. There are going to be corrections. We're going to have to make changes as we go along. I think no one has the right answer now. I'm sorry to be non-committal.
Okay. Dr. Carr, thank you very much. Non-committal is okay. Thank you for watching. Our next broadcast, we're going to be dealing with policing in Canada, politicians in Canada, race in Canada. For the LeDrew 3-Minute Interview, my name is Stephen LeDrew.